Okay, this video is called Does Viagra Increase Myocardial and Heart Attack Risk? Okay, so the first paper here is some genius, 41 years old. He smoked marijuana, cannabis, and simultaneously used Viagra. 12 hours later had a myocardial infarction. And the reason is the enzyme to metabolize, break down Viagra is the same one that's used to break down the marijuana, cytochrome P450-3A4. It's a liver enzyme. So what am I saying? First of all, cannabis is a very dangerous drug. It is a toxin to the brain, and in my extensive clinical experience, I look at tons of people with cognitive impairment. Neurologists all the time tell me they see all these messed up patients from marijuana. But at the same time, when I talk to some patient that smokes marijuana, they all tell me, oh, how clever and smart they are to smoke marijuana. No, they're idiots. They're low-functioning idiots. I always try to leave the room when somebody starts telling me about cannabis because it's like the same moronic stupidity. But the weird thing about it is when somebody smokes cigarettes or alcohol, they're like, yeah, they know they're screwing up, and they admit it and say they're trying to quit, okay? But when they smoke cannabis, they think they're clever. No, they're stupid. All right, so anyways, here's the one guy who gave himself a heart attack because he's an idiot. All right, now here I'm part of my site is I'm trying to teach you how to think, because you always have to work your way through the fog of BS that you're going to encounter. So Viagra associated with myocardial infarction, oh, no abstract. Whenever you see there's no abstract, it usually means the corporation is trying to hide something from you. Okay, here's another paper. Viagra and cardiovascular disease. Oh, no abstract. Oh, gee, what a surprise. Another paper on Viagra and myocardial infarction. Myocardial infarction, of course, means heart attack. No abstract available. So, whenever you see no abstract available, you should immediately suspect they're trying to hide something from you. Trust me, okay? You got to learn how to read this. It's called hiding things behind a paywall. You have to pay to get access to the article, and it's a pain in the ass, so almost no one does it. So again, these are typical ways that stuff gets hidden from the public. Okay, now the other thing that happens is, so here's the usual. I want you to recognize this pattern, so whenever you see it, you should be suspicious of it. Somebody who's honest writes a paper about a problem with a drug, like with Viagra in this case. And it'll be an honest paper about some patient who had a surprise complication. And then a couple other papers will come out noticing the same complication. Then all of a sudden, no abstracts on anything else. And then there'll come what I call the corporate paper. Now, I did not check if this is a corporate paper, but I can just tell you this is what happens all the time. We've seen this happen with soy. We've seen this happen with multiple other situations. The corporations, the industries, they can just buy the journal and start writing their own nonsense papers, okay? So like I said, I didn't check if this one was, but I will bet you it was just based on my experience. It's the typical pattern. So then a paper comes out saying, oh, Viagra has no increase in risk of myocardial infarction. None whatsoever. It's totally safe, just like a placebo. Yeah, right. You have to learn to recognize this BS because somebody will come along and tell you, oh, there's no risk with Viagra. No, use your brain. The early papers are usually the best ones. Okay, then eventually, I'll tell you what happens after that. Then they get a committee of doctors from some university, and all these doctors are doctors that want to publish papers, so they have to stay on good terms with the pharmaceutical companies, because otherwise they'll never get another dime of grant money. So you can guarantee whenever these committees meet, they're going to be a little bit careful because they don't want to get sued and hurt the patients, but they're always going to exaggerate the benefits of the pharmaceutical because they don't want to piss off the drug company. Okay, the drug company's got billions of dollars. They can, pressure the university to fire these guys. Lots of doctors have been fired if they piss off industry. Okay, all right. So what did they come up with? So this is an industry committee. This is in the Journal of Circulation. They basically came up with the conclusion Viagra is contraindicated if the person's concurrently taking nitrite vasodilators for coronary artery disease because that can drop their blood pressure too low. If they also have diseases that make it hard for them to maintain their blood pressure, active coronary ischemia, congestive heart failure, then yeah, they shouldn't be taking something that could lower the pressure and decrease perfusion of the coronary arteries. Here's another one. If they're on complicated multi-drug routine for their hypertension. Lots of hypertensive patients are on multiple drugs. I have good close friends that were on multiple drugs before they went vegan. They'll also say, watch out for anything that'll prolong the half-life, like marijuana we just spoke about. So what's my point? You'll never in a million years see any of them recommend going on a low-fat vegan diet. The arteries that go up to the brain, the carotid arteries, they're typically, let's say the internal carotid arteries, they're about 6 millimeters in diameter in a robust, healthy person. The coronary arteries are about half that in diameter approximately. They're about 3 millimeters in diameter. The arteries going to the Johnson, the pudendal arteries, are only about 1.5 millimeter in diameter. So what I'm saying is, quite often atherosclerosis is going to first manifest by causing impotence. So lots of guys, before they've ever had a symptom of coronary artery disease or cerebrovascular atherosclerosis, they'll present with being impotent. And the ballpark numbers are 30% in their 30s, 40% in their 40s, 50% in their 50s, 60% in their 60s, 70% in their 70s. And what I'm saying is the best thing these guys could do, low-fat vegan, low-fat, low-sodium vegan, all these things that reduce atherosclerosis risk factors, that gives them the best chance of keeping those arteries open that go down to the Johnson. Once those arteries are, fully closed, when they're just narrowed, Viagra might work. When they're fully, completely closed, then Viagra's not going to work. And if they're going to do anything there to try to revive the Johnson, they're going to need to get a penile prosthesis, which is a pretty big invasive surgery. And sometimes those penile prostheses get infected. I've seen plenty of those things get infected. So what I'm saying is the smart move to avoid this whole pattern of problems, just be low-fat vegan. And you'll never probably, have any atherosclerosis-related impotence. McDougall's got the good story of when he was out in Hawaii, the manual laborers working in the sugarcane fields, they were eating the old-fashioned plant-based diet in comparison with the wealthy people, the doctors and lawyers and businessmen living in the big cities. All the wealthy people were eating meat and processed food with oils, and they were impotent, high incidence of cancer, coronary artery disease, etc., in their 50s and 60s, etc., versus, he said, these manual laborers who were eating old-fashioned plant-based diets, they'd retire at 65, go to the Philippines, get themselves a new bride over there. Philippines was very poor at that time. They would raise a family, die in their late 80s, okay? Talk about an inspirational story. A guy who's healthy at 65 can start over and have a family, Maybe I should do that. I don't like to travel, though. I don't want to go to the Philippines. It's too far away.